is one of the most commonly overlooked aspects of pet health care. In fact, a recent study revealed that 2/3 of all pet owners do not provide the minimum amount of dental care that is considered essential by veterinarians. Veterinary dental specialists have found that by age 3, 80% of all dogs and 70% of cats show signs of oral disease that doesn't just affect the gums and the teeth, but has far-reaching effects on the heart valves, the lungs, the liver, and especially the kidneys. Because today's pets live 2 to 3 years longer than they did 30 years ago, and since no one wants their pet to live half of this long life with seriously diseased teeth, or even no teeth at all, it's important to start very early with routine oral care and to get that annual examination, which includes an assessment of your dog's, cat's, or rabbit's dental health. Some aspects of your pet's oral health are genetically determined, as is the case with humans. But in our practice, we proactively begin discussing low-impact, well-tolerated initial home dental care with the first puppy or kitten visit. This involves gently handling the pet's head and neck, lifting the lips on both sides, and sliding a finger along the outer surfaces of the teeth. As the pet becomes accustomed to this contact several times weekly, over a period of time you can gradually increase the abrasive force on the teeth by wrapping a single layer of a lightly moistened 2" by 2" gauze square over your index finger and begin using it to clean the outside surface of the teeth, especially all the way back to the molars. After several weeks of acclimating your pet to this initial step, then touch the moistened gauze to a small amount of baking soda, which will really begin to introduce light abrasion to aid in a more effective cleaning of the teeth. At this point, you can either continue this low-impact effective cleaning long-term, or you can begin to introduce soft brushes designed specifically for dogs and cats. Using the flavored paste with a brush can ultimately be effective, but sometimes the delicious chicken-flavored paste can actually make successfully cleaning the dog's teeth difficult because dogs love the taste of that chicken-flavored paste, and a dog who's now licking and swallowing becomes a moving target for the brush. Also, I've found that the soft plastic finger brushes you can find in the stores have bristles that are also made out of soft plastic, and they're very smooth, so consequently their ability to remove the daily tartar buildup is really unsatisfactory. So, with regular dental care at home, the lucky pets with great genetics for a clean mouth can usually maintain healthy gums and teeth for years. Some pets, however, come from the shallow end of the genetic pool for oral health, and in spite of your best efforts, plaque can creep up on your pet's teeth, causing gingivitis and halitosis that, as George Carlin would say, could knock a buzzard off a manure wagon. This is when your veterinarian or dental specialist must intervene with a thorough evaluation of tooth and gum health, and then formulate a plan for scaling and polishing the teeth, then tackling the gum disease called gingivitis that routinely leads to loose teeth, bone disease, and root canals or extractions. Usually, anything but the most minor dental care in cats, dogs, and rabbits requires some form of anesthesia for the veterinarian to complete the work required. When significant bone resorption and erosion is suspected, dental radiographs can be very helpful in identifying which teeth are healthy and which are diseased. Let's look at this chart showing the progression of dental disease and gingivitis. This is the canine mouth, and it does clearly show the progressive periodontal disease that can lead to lost teeth. We want to intervene with dental prophylaxis and dental care and treatment between pictures 2 and 3 when there aren't deep pockets around many teeth, when you don't have dental ligament loss and bone resorption that's caused by the deep infections. By the time you get to the bottom picture there, you're probably looking most likely at extractions, and we would like to avoid that at all costs. Cats' mouths have some unique problems that differ from the dog. While cats can form standard plaque and gingivitis that is similar to the dog, they can get erosions at the gum line called feline resorptive lesions or feline neck lesions. While they look like cavities that are eating away the enamel and the dentin of the underlying tooth, they are not cavities and cannot be filled like a cavity that we get. The teeth can be so damaged that they can break off, so these teeth with neck lesions are usually extracted so that root pieces are not left behind. Another unique feline oral health problem is an inflammatory infiltration of cells in the back of the mouth and around the gums that can be so painful that the cats can't even open their mouths to eat. This condition is called stomatitis. It is not well understood at this time, but usually cats can get some relief from corticosteroids, antibiotics to control the primary and secondary infections, and sometimes extractions of the associated teeth are even necessary to control the severe inflammation. Rabbits, being herbivores, differ from carnivores in that they have both incisors and molars that continue to grow longer throughout their entire lives. It is essential that they be fed lots of fibrous hay and sometimes have safe types of wood blocks or fruit tree limbs to chew on to wear down those incisors and molars to prevent malocclusions and sharp dental spurs, which along with tooth root abscesses are the major problems encountered by our herbivorous pets. Signs of herbivore dental problems can be elongated, crooked teeth, facial swellings, decreased appetite, and profuse salivation wetting the chin and neck of the bunny. A major part of the annual bunny or guinea pig exam centers around the condition of the mouth and a discussion of the proper foods they require to maintain optimal health. So all of our common pet species can benefit from home dental care and your careful observations, along with an annual comprehensive examination focusing on oral health. This has been another pet health tip from the staff of the Pittsburgh Spay Vaccination Clinic, a full-service veterinary facility.